and I'm also the temporary CD at the Arlethea Spring Center. So currently, right now, I'm getting my PhD in ABA at the Chicago School. So one of my presentations that I had to do last semester was a lightning talk on an ABA topic. So I decided to do this topic. So the CEU is actually an extension of that topic. Today, we'll be discussing applying cultural considerations to teach parents effective punishment strategies to replace physical punishment. For the learning objectives, the goal is to understand the role of cultural factors and how they play into the perception and understanding of punishment procedures, recognizing our own personal and professional biases as it relates to punishment, identify the pros and cons of function-based punishment procedures in practice, understanding ethical considerations when it comes to punishment implementation, and we want to become prepared to have these sensitive conversations with caregivers regarding the use of punishment and potential placement of punishment procedures in our programs. And collaborate with parents on the most practical, effective, and ethical reinforcement and/or punishment strategy to modify behaviors. So our first question is, has a parent ever admitted to you that they implement punishment procedures on their child? So Alice and I couldn't figure out how to get the polls to work. So if you guys can just type A or B in the chat, and then we'll go from there.
It is overwhelmingly A, yes response. A few B's here and there, but overwhelmingly A's yes response.
Okay, cool. Yeah, so I figured a lot of us have had implemented punishment at least once or twice. So it's good to know that mostly everyone has had some experience with punishment. And if not, hopefully today you guys will get a better understanding of what punishment may look like and how we can potentially implement those into our programs if you haven't had any experience implementing punishment. Okay, so next question, how did you respond? Oh. Yeah. Okay, yes. I'm sorry. I got fixed up. Okay, so if a parent has admitted that they used punishment on their child, how did you respond? So number one, I informed them that I respected their decision, then redirected the conversation. B, I tried to communicate an alternative punishment strategy to implement with their child. Or C, I tried to emphasize the importance of exhausting less restrictive alternatives like reinforcement procedures. So if you can just type in the chat, A, B, or C, what your response is. And if you've used multiple of these responses, that's fine. So I guess just the most common one that you've experienced in practice.
There are a mix, I would say a little bit more of C than anything, but some A's and B's as well, varied.
Okay.
One
Cool.
noted like without judgment too. I think that's important to note too, without commenting or judging based on those.
Yeah. For sure. Yeah. Today we're definitely going to be talking a lot about kind of that judgment aspect. And that goes along the lines of like our own personal biases and perspectives when it comes to punishment. So understanding how to respond in a sensitive manner to parents. I figured C was going to be the most selected response. So as BCBAs, it is our ethical responsibility to exhaust those least restrictive strategies first before implementing punishment. So that definitely makes sense. But inherently, none of these options are wrong, and we'll discuss these a little bit more. What is the correct answer? So as stated, none of these are technically wrong answers. So of course, we should always try to respect decisions that caregivers make regarding their child, regardless if we agree. I know a lot of us meet with parents and they tell us kind of what they're doing or what they're not going to do or whatever the case is. And as clinicians, it's not our job to judge and tell them like, hey, I know best, but rather to collaborate with them so that we can get the best possible care so that their kiddo can make progress and we can meet those goals. So just redirecting the conversation may not be the most appropriate option, but it is important to try to communicate alternative punishment strategies from a behavioral analytic perspective, but we don't want to discredit the caregiver's decisions. So as mentioned, it's our ethical responsibility to minimize negative outcomes of behavioral treatments. So this means that we're attempting to exhaust all least intrusive strategies to address behaviors prior to implementing more intrusive strategies like punishment. So to be clear, I know there's a lot of kind of talk about punishment and whether we should be implementing it or not be implementing it. And I think looking at the origins of behavior analysis, it was very punishment heavy. Of course, in the experimental analysis of behavior, there was a lot of tests on non-human animals, so punishment was kind of running rampant. And then as the field progressed, and we started applying it in applied settings and clinical settings, of course, a lot of the punishment procedures that were used, years ago are just not safe, appropriate, ethical now. So trying to shift the perspective of what punishment really means and understanding that, it can be implemented in a safe and ethical manner. And then the last thing to note is that environmental and cultural variables do play a role in parenting belief, goals, and values. And we're going to discuss those cultural variables soon. So we're going to talk a little bit about some cultural views on physical punishment so that we can get a more comprehensive understanding of the role of culture in, punishment. In the Black community, research supports that Black children are more likely than white children to be spanked. So this actually led me to doing this research, just collaborating with a lot of my Black parents, and then also like my white parents, like for my clients, and just kind of realizing the disparities and kind of what punishment looks like and their responses to it or what they're doing at home. So this did lead me to just doing some more research on my own, and research did support my suspicion. So again, Black children are more likely than white children to be spanked. Whoopings are a cultural norm in the Black community. In the white community, physical punishment is less normative in white families compared to Black families. Research found that um, this is supposed to say white, found that white respondents were likely to have less favorable attitudes towards spanking compared to Black families. And then in the Latino/Latina community, spanking tends to be viewed as an appropriate, common, or even necessary method of discipline. Similar norms compared to the Black community, and Latino/Latina parents are typically more controlling and authoritative compared to white parents. And then we're going to talk a little bit about these views in religious and just different generations. So Christianity, there's a scripture in the Bible that says, "Don't fail to discipline your children. The rod of punishment won't kill them. Physical discipline may as well save them from death." Some argue that the rod of punishment should not be taken literal. So I've met some Christians who say, "Hey, the Bible says this, so we should be physically punishing our child," and some see it more as a metaphor. Either way, the overall concept is that punishment is a form of discipline, that if you are withholding that discipline, you're not doing your child justice. I'm a Christian myself, and I've kind of had my own beliefs as well, but there may be different views based on race and ethnicity as well within the Christian community. So between the Black community, the white Christians, the Latino or Latino Christians, Asian Christians, or whatever the case is. So that's important to note. The Torah is restricted to the first 5 books of the Hebrew Bible. So don't put a stumbling block before the blind. So I did a lot of research on this. Again, I'm not Jewish, so I was trying to better understand kind of their perspective and what the scripture was trying to say. So if you are Jewish and I'm misspeaking, please reach out to me and correct me so I can be educated myself. But from what I gathered across the research, according to Torah, parents can strike minor children, but once the older child reaches bar bat mitzvah age, striking is not permitted. And then millennials versus boomers. Millennials have adopted a gentle parenting approach, which is an approach that is more empathetic and respectful than authoritarian parenting. And then 50% of millennials who are parents have spanked their child compared to the 72% boomer parents. So that's a little bit difference between millennials versus boomers. Okay, so next question. Based on your culture, what is the common view of spanking? So A, spanking is looked down upon and is not common in my culture. Spanking is a necessary part of teaching and disciplining children. Spanking is neither viewed as necessary nor is it looked down upon. My culture has a neutral view of spanking. So I'll tell you mine and my culture. So it's definitely B. My mother is Jamaican and my dad is from Alabama, so African American. So it's definitely the norm. But as I've grown older and being in this field, I definitely have shifted my view of spanking because it's not always the most effective punishment strategy per se. But again, I'm not a mother, so I don't really know how it is being a mom. But I'm interested to see kind of what your cultures are talking about.
It is not much of a surprise to me, but very varied throughout all of the
Yeah.
responses. Very, very different, which makes sense from different parts of
Mhm.
the country, different cultures coming from, but very varied. No like
Okay,
trend.
cool. Yeah, that's kind of what I was assuming. It's a lot of different individuals, different cultures on. So I expected a varied view on it. So okay, cool. Mhm. So, what is the issue when it comes to punishment? Excessive physical punishment towards children can indicate abuse or neglect. As mandated reporters, of course, we must report this whenever we do suspect any abuse or neglect with any of our kiddos. However, it's important to note just because a parent admits to spanking or whooping their child, this does not necessarily mean they are abusing them. This is very, very important. I've spoken to BCBA sometimes and they mention like, oh, I think mom said that they whooped the child or whatever the case is. And of course, like if it's excessive and we had to look into it from a mandated reporter perspective, we definitely take that route. But it is sometimes to kind of pause and just think like, okay, is this a mandated reported situation or is it just this parent disciplining their child in, the manner that they feel is appropriate culturally? Nonetheless, if physical punishment is administered in a context that is less normative and more aberrant, the child will likely reject the parent's disciplinary message. In other words, punishment may not always be effective. So a lot of times, parents are quote unquote whooping or spanking their child, and it's just not in alignment with the function of the behavior. So they may be whooping the child for attention-seeking behavior, but now they've given the child more attention and the behavior increases. So they're like, oh, I'm spanking them, but I don't know why the behavior is increasing. And we'll go over that soon too, talking about just the functions of behavior and why spanking is not always the most appropriate when we're talking to caregivers. So instead of promoting appropriate behavior, the physical punishment may just promote negative reactive behavior. So as mentioned, attention-seeking behavior may escalate or whatever the function is. If a spanking is a response and it's not adequately addressing the function, as we all know, we're BCBAs that will inadvertently increase the maladaptive behavior. And we are at the first attendance word. So the first attendance word is aversive. So if you can just note this down for later. All righty, one more time. Aversive is the attendance word, and I'm gonna move on like 2 seconds. All righty. What does ABA say about punishment? Punishment-based procedures are strategies used in ABA and special education to reduce challenging behavior. So when a punishment procedure is implemented, it is expected that the behavior will reduce after the implementation of punishment. So there's negative punishment and positive punishment. So when negative punishment or reinforcing stimuli is removed and the likelihood of that challenging behavior decreases, with positive punishment and aversive stimuli is added and the likelihood that that behavior also decreases. So some types of punishment procedures use an ABA overcorrection, positive practice, verbal reprimands, timeout, restraints, holds, planned ignoring, etc. Of course, these all have different severity levels. So positive practice may be very different than a restraint or hold, or planned ignoring is a little bit less extreme than like maybe, yeah, a restraint or hold. Those are pretty extreme, I would say. So they all have different levels of severity, I would say. As clinicians, our ethical responsibility is to attempt to exhaust reinforcement strategies prior to implementing punishment strategies. So of course, we're going to talk about the code of ethics. So according to the code, section 2.14, selecting, designing, and implementing behavior change interventions. So I just highlighted the most important parts for this presentation. So we definitely want to prioritize those positive reinforcement procedures. And behavior analysts should also consider relevant factors, so risk, benefits, side effects, client and stakeholder preference, implementation efficiency, cost, and design and implement behavior change interventions to produce outcomes likely to maintain under naturalistic conditions. So I know we've been talking a lot about spanking and whooping. So to be clear, obviously we're not going to spank or whoop any child in practice. However, a lot of our parents are doing this at home. So the intention of this presentation is how do we suggest alternative punishment strategies to those while also being sensitive to what the parents are doing at home. So if we do get to a point where we are like, punishment is the most appropriate strategy, whether that's in home or in clinic, we want to make sure that we've, number one, prioritized positive reinforcement procedures, exhausted all those options, and then we considered all of these relative factors to minimize those negative effects. Section 2.15, minimizing the risk of behavior change interventions. So when we recommend and implement restrictive or punishment-based procedures, behavior analysts should comply with any required review processes. So that's just whenever we implement punishment, I know we typically talk to the parents and we get approval for it. It depends on the organization with what strategies you have to take when it comes to implementing punishment. I know I've had some companies where you have to print out the behavior plan and have the parents sign it, and it has to be communicated with like the regional director and things like that. In some companies, the BCBAs have a little bit more autonomy, and as long as you and the parents are in agreement, that's the strategy. So just whenever you're implementing any of these strategies, you want to make sure that you're following whether it's the insurance requirements, the company requirements, ethical requirements, to make sure that we're implementing it in the best possible manner and addressing all of these things at once. And then, of course, we just want to minimize the overall negative impact. So the goal is to improve behavior. We don't want to implement something that's going to make our child worse and just be more negative than positive. So just really making sure we're using our clinical decision making to implement the most appropriate punishment strategy if we are selecting it, so that it's not as punitive as not more punitive than it needs to be. And then also very important, we don't want punishment to be the final say so in any program. So even if we are implementing a punishment procedure, we want to already have a plan in place for fading out that punishment procedure so that we can go back to those less intrusive strategies. And then next question, is it ever appropriate to implement a punishment procedure prior to implementing a reinforcement procedure? Chat, yes, no, never, sometimes. Oh, there's no. Yes, never, sometimes.
Majority sometimes.
Okay.
Says sometimes.
Yeah, I'm actually pretty shocked. I thought the majority would say never. I agree with sometimes, but it really just depends on the situation for sure. I've had clients who come in and they have such a severe behavior that's dangerous for them, that's dangerous for other people involved. So we kind of have to go to those more restrictive almost immediately just for those safety concerns. But there are other situations where sometimes it's appropriate. So cool. So this is just a random scenario. It's not really a case study, but a random scenario that I came up with. And I just want everyone to kind of consider some of the things when it comes to punishment, cultural considerations, and then the best strategies to use. So a 15-year-old Black male just started ABA services 1 month ago. He weighs 185 pounds and is 5'5". His mother reports that he has a history of eloping out the house. 3 weeks ago, he ran down the street and a neighborhood police officer found him and brought him back to the house. The police officer informed his mother that when he tried to talk to him, he initially ran away from him. Luckily, the officer was able to catch up to him. The mother admits that whenever he does this, she spanks him when he comes home. When she spanks him, this usually deters the behavior for about a month. Mom does not report any type of reinforcement for staying in the home or functionally communicating his wants or needs to go outside. The function of this behavior is escape. So some things to just consider with that previous example. So elopement outside the house is very serious and dangerous behavior that needs intervention immediately. This is a Black male. He's 185 pounds, so that that's a big size for his age. So his build is similar to an adult male. It is likely that he may be mistaken for an adult male. So research shows that Black Americans are more likely to experience traumatic and unjust treatment by police officers than white Americans. This child may be seen as hostile or dangerous because he is a larger Black male, and his mother is also not teaching functional communication training. Punishment delivered by the mother seems to be effective. What other punishment procedures may be appropriate here? So you don't have to put this in the chat. If you want to, you can, but it's just something to consider. And then the thought I put was the punishment implemented in ABA for this child is likely going to be less severe than the punishment implemented by a police officer. So when we have behaviors this severe, we really can't, for lack of better terms, drag our feet on deciding what strategies we need to implement and the severity of those strategies. So his mother is spanking him, but clearly it's not as effective. So number one, we definitely want to teach functional communication. We want him to be able to communicate his wants and needs for going outside the house. We definitely want to implement those antecedent strategies to prevent the behavior, number one. I don't really know if punishment would be appropriate on our behalf here. It's just something to consider. Obviously, we would need more information about, more in depth about the function, the history, all that good stuff. But it is important to consider, like, when he runs out the house, if he's seen as a Black male, this could be a very, very dangerous and life-altering situation. So it is important for us to become very serious when it comes to deciding what strategies to use to prevent this behavior and address it very seriously. Okay, so I'm gonna exit right now, and then I'm gonna send this in the chat. So give me 1 second. And okay, so this is one of those little word things that, hold on, I can't think and do this. I'm gonna share my screen again. Okay, so I put test here, but this is one of those things where if you could just type the word in and then it should show here. So I put the link in the chat. Please let me know if it's working. But basically the question is, what punishment procedures have you implemented with a client? So if you type it, it should be showing up on my end. Oh, yay. Okay, good. Response calls. I was just talking to a parent yesterday about that for like a token board. Positive practice, love it. One of my favorites. Negative reinforcement. Okay. What is RIRD? If anyone, whoever typed that, if you can put that in the chat so I can know what that is. Response cost. Okay, a lot of response cost. Timeout. So I know we have that exclusionary timeout and inclusive timeout. Blocking. Okay. Reduced ignoring. Yeah. I like the planned ignoring, especially for attention-seeking behavior when it's not dangerous. But yeah, it's really hard to teach parents planned ignoring because it's like, oh my goodness, ignore your child when they do this, and it's just like impossible for parents. But it's always worth the try to teach them to do that. Okay, so we'll keep this up for like another like 10 seconds or so. Thank you guys for participating. Blocking, response interruption. Cool. All righty. So yeah, those are all pretty common procedures used there. Okie doke. Checking our biases. So, section 1.10 of the code discusses awareness of personal biases and challenges. Behavior analysts maintain awareness that their personal biases and challenges may interfere with the effectiveness of their professional work. So we all have our opinions on punishment, whether it's from a personal perspective, a professional perspective, or just clinical. So it's just important to be aware of those. So sometimes those biases may interfere with our ability to really connect with parents and collaborate on the best strategies for the child. So I know extinction. Extinction is not a punishment procedure, but just for example, I know there's a lot of controversy regarding extinction in the field, and I definitely see both perspectives. So with things like that, we just want to make sure we're open to kind of hearing the other perspective. And if we are going to say like, no, this is not appropriate, what is the alternative, right? Like, what is a reasonable alternative that may be just as effective or even more effective? And just being able to hear the other person out, whether it's stakeholders, whether it's parents, other clinicians, just so that we're in a more collaborative state. And then we're not letting our personal biases or challenges interfere with care delivery. So example, I don't believe in implementing punishment required with clients. Challenge question, what does the family believe? We always want to implement a replacement behavior when it comes to, making a behavior plan, we have a replacement behavior. So the challenge with saying things like, I don't believe in implementing this, we also have to ask like, well, what does the client's family believe? Um, because whether we believe it or not, the parents are doing something at home. And as we know, if the parents aren't in alignment with our plan and what we're doing at the center during therapy, the kiddo is just not going to make progress and there's going to be a huge barrier. So if a parent is spanking their child at home and they truly believe in the effectiveness of punishment, as they know it, providing a reinforcement procedure as an alternative may not be a practical solution. So again, to reiterate, we're not going to say, oh, mom is spanking him at home, so we're going to spank him in therapy. But I've tried before, before kind of educating myself on this topic, if a parent was admitting to spanking or, implementing like timeouts or like other punishment at home, whenever I tried to just suggest like a reinforcement procedure, they were just like, no, like flat out no, like I need him to have some type of consequence for this behavior. And again, as we know, reinforcement is a consequence. Technically, like we are responding to the behavior, but sometimes when parents, they don't have, a lot of them don't have the background or understanding of ABA and concepts that we do. So from their perspective, they're like, oh, well, I'm just not going to reinforce this behavior. So it is important to consider, well, if the parents are going to do some type of punishment at home, I would rather you do this. I would rather you do a timeout or a plan to ignore or a response cost versus, spanking for whatever reason. So that's just something to consider. And then the cycle of inadvertent reinforcement. So for example, the child engages in screaming behavior for attention. The child is spanked for screaming. The child receives attention. The frequency of screaming behavior increases. The child is spanked again, and then it just kind of keeps going in a cycle. When I'm explaining to parents why punishment or whatever strategy that they're using, it's not always punishment, just why it's not as effective. I try to break it down in this cycle sometimes to show them like, this is why this is going to continue to happen, or this is why it's been happening so frequently because you're responding like this. So what can we do to break that cycle? And then giving them suggestions. Well, I would suggest doing this instead, or I would suggest, responding in this manner. What should we do? Recognize cultural considerations when it comes to punishment. Some parents, as mentioned, don't see reinforcement as a consequence. The word consequence is inadvertently paired with punishment. This doesn't mean that we just implement punishment procedures blindly and unethically because parents don't understand. We're never going to say, okay, well, we'll just do punishment because that's what the parents want. Absolutely not. The goal is just to collaborate with them and get a better understanding of what they're wanting. Because some parents like just will spank or whip their child out of frustration, and they're not really thinking about the actual like outcome of that consequence. So sometimes when we're having parent meetings, if we're able to break it down and give them a better understanding of, reinforcement contingencies or punishment contingencies, this typically helps with that behavior at home. We should focus on replacement behaviors that are ethical, effective, and likely to be implemented by caregivers. A lot of times I have a lot of suggestions and strategies for families to do at home. And I have to remind myself, I'm like, they're not going to do that. And that's just the reality of it. We have parents who are overwhelmed, they're full-time employees, they're full-time moms, full-time dads, whatever the case is. So we want to make sure if we are giving them strategies to use at home, it's something that is easy to implement and it is effective as well. And then we will also want to teach parents the importance and effectiveness of reinforcement procedures, remain open to meeting the parents where they are at when it comes to punishment procedures. So going back to the first question, it was like, how do we respond when parents admit that they're punishing their child at home? So we don't want to come from a place of judgment or bias. We want to be open to having those conversations. Like a month ago, I met with a parent for the first time, and she was like, "Yeah, I just spank him. I just whoop him because he, interrupts me all the time and he does all this or whatever the case is." So after looking at the function of the behavior, the interrupting was because of attention. And mom was like, "I don't want you to think I'm abusing him. Like, I don't want you to call CPS." I'm like, "Hey, I don't think that at all. Like, I appreciate you. I appreciate you for disclosing this to me. So I'm not judging you. However, I would suggest this instead." And then she was actually really open to the strategies that I was suggesting. So we actually went into like a planned ignore procedure for those attention seeking comments. And that has been very effective. And she's been doing that a lot more as well. So it's just important to just validate where they're coming from, and then getting a better understanding of what's going on. And then if you have another suggestion, go into that. But it was very important for me and her to give a suggestion for like a punishment strategy, because she was like, he needs a consequence. He needs to be punished for this. What do I need to do? Right. So I was like, okay, planned ignore would be an appropriate alternative. Of course, we are doing functional communication training, reinforcement for good behaviors, all that stuff. So we're always going to have reinforcement in addition to punishment. But punishment is not a bad word, and there's a way to implement it that's safe, effective, and ethical. And then recognize that the punishment we teach and implement in ABA is less cruel than the punishment a parent has been taught to implement in the home setting. So me implementing a plan to ignore for this client is technically, I would say, less cruel than being spanked for ignoring. That's very subjective statement. But I think that's just something we should consider when we're trying to shy away from suggesting replacement punishment procedures. And then we should be providing parents with effective punishment strategies rather than solely teaching reinforcement strategies as appropriate. Sometimes punishment is just not appropriate. It just doesn't make sense in the situation. But in some situations, it does make sense. So just really using your clinical decision making there. Potential positive outcomes of punishment procedures. Research shows that functional communication training plus punishment can be more effective than punishment alone. It can promote generalization and preparation for real world circumstances. So this is especially appropriate like in the school setting. So some say that like saying no to a child is punishment, and some don't really agree with that. But let's just use the example of, saying no. So I know a lot of BCBAs who don't agree with telling a child no. So we use alternatives like not right now, which is fine. It really just depends on the client, because some children are very aversive to the word no. But also we want to understand that in real life, what are the contingencies that this child is going to face? So in ABA, we can say things like not right now, and teach them that they may not never hear no in ABA. But when they go to school, when they're at home, when they go to a grocery store, in society, you're going to hear the word no. So implementing these procedures can promote that generalization and preparation for those real world experiences. So it's socially valid. And then it can be effective if used in conjunction with function-based treatment. So we're never blindly going to just implement punishment without understanding the function, and then also implementing, reinforcement contingencies as well. And it can be an effective replacement for potentially harsh alternatives implemented by a parent or others in society, as we discussed. And then the procedures are evidence-based, so they can help predict and control behavior in a safe, appropriate, and ethical manner. Of course, there are several negative outcomes to punishment procedures. If it's used incorrectly and excessively, it can do more harm than good. It may accidentally reinforce the challenging behaviors if used incorrectly. So as mentioned, if the function is attention and then a kiddo is getting spanked for attention, that may inadvertently increase that attention-seeking behavior. There's a lot of controversy regarding the efficiency and ethicality of its use. And response suppression may be temporary. So punishment may not be practical or appropriate ongoing strategy for behavior change. So again, if a parent is spanking the child at home and say it is effective, right? Like the child is not doing a behavior at home because they're getting spanked at home. When he comes to ABA or when he comes to school, does that behavior suppression remain consistent without the spanking? Most oftentimes, the answer is no, because we're not going to spank a kiddo in ABA. They're not going to be spanked in school. So we're not able to generalize that response across different settings. Habituation is a reduction in the responsiveness to a stimulus following repeated or prolonged exposure to that stimulus. So if a kid is always getting spanked, like I've seen kids who get spanked so often, they're just so kind of immune to it, and it just doesn't even really do anything for them either. So if we're excessively implementing punishment procedures, sometimes the client just stops caring, and then the behavior continues despite our efforts to implementing that punishment because it's used so excessively. And then, of course, there may be short-term and long-term negative mental and emotional effects of punishment. Final considerations. There are both potential positive and negative outcomes of punishment. As BCBAs, it's our ethical responsibility to exhaust reinforcement procedures prior to implementing punishment procedures. Nonetheless, this does not necessarily mean that punishment should never be used. We should just really consider the effectiveness of punishment versus reinforcement, or using a combination of both. We must consider cultural and personal biases when it comes to implementation of punishment. And then families may have different viewpoints on the incorporation of punishment procedures in ABA programs. As clinicians, we must be considerate of the family's viewpoints and work collaboratively with families to address cultural differences regarding punishment. And the final attendance word is ethical. And I did leave some time just for like questions and kind of an open discussion, because I know that this is a pretty controversial topic. So I am interested in kind of hearing you guys' perspective and kind of your experience with this. So again, the final attendance word is ethical, and I'm about to stop sharing my screen in just a second. Okay. And then, of course, references, all that good stuff. View. All right, if you could just raise your hands if you have any questions or concerns. Yeah. Yes, Christine.
Hi, thanks. How do you handle when you have a parent and, let's say, a grandmother, they're raising a child and they have completely different views, and one may be using the physical punishment and the other, because the other is working all day and they're not there, so they have different views of how to.
Yeah. So I actually have that. I have a parent who I do her parent trainings with mom, but mom works a lot, so grandma is the primary caregiver at home. So the first strategy was inviting grandma to the caregiver collaboration meeting. So anyone who's a caregiver that's in the home that is assisting with the upbringing of this child, I try to prioritize getting them both on the meeting, and then trying to get a better understanding of grandma's perspective. It's very hard because you know how grandmas are. So it is very hard to shape that behavior. So I do focus a lot on, you know, mom and just reiterating our strategy and what we're doing. And since she has a relationship with grandma, maybe mom can be that, like bridge that gap in, you know, teaching grandma on her end. But in some circumstances, unfortunately, there's only so much we can do with controlling what's going on at home. So just inviting grandma to the parent meetings, and then just aiming to bridge the gap with mom. I've also created like in-home behavior plans that are in layman terms. That is, you know, we put on the fridge and we give to everyone in the home. So that also increases the likelihood of everyone following through at home. Good question. Do you know if there's a correlation between parents who spank their child and the child being more aggressive? I think it just depends. Like, it depends on the child's experience with life, if they have a history of trauma, their history of aggression. It really just depends. I have a client who had a lot of aggression at the school, and I did realize that parents were spanking them a lot at home, but that wasn't like the only function of that aggression at school. Like, there's a lot of other variables. So, but I'm sure that there's research on that. I'm interested in knowing that answer as well. Yes, Marianne. Oh, you're on mute.
There we go. I wanted to say that I love this presentation, and I think it's like very important and really like good information for teens to have. I wanted to ask, is this is recorded and we're gonna be able to access it on the BCBA collab page? Is that correct?
Yes.
Okay, cool. And then I just also wanted to add in, I've had it several families, all different backgrounds. I mean, I've had older grandparents with Catholic raising who were very punishment based, and I've had military families who were very punishment based. And one thing that I've personally learned is just having that level of compassion that you talked about in this presentation, and that understanding that we're not going to hop in and get them on board to make all the changes right away, and being patient with them and working with them and modeling things, I found to be the most effective. And I know it can be hard because sometimes we're like, oh, if they would just make these changes, things would get better. But I think that as a clinician working on that patience and understanding, can go a really long way. I've had families that I spent a year working on, and a year later they're like, "Man, I should have listened to you a year ago about making that little adjustment." So I just wanted to give everybody kudos for working with families that are heavy in the punishment realm. It can be challenging and disheartening sometimes, but there is light at the end of the tunnel.
Yeah, for sure. Well, thank you so much. And yeah, I definitely agree. I think the compassion is the key word there. I think with a lot of the parents that we're working with, like we talk about, is they're stressed out, they're burned out, they're overwhelmed. It's a lot going on. So we also have to think of the response effort for just spanking a child, right? It's a lot easier to just do that and kind of get it over with versus implementing the strategies that we're suggesting, because it's just a lot easier. So I think having that patience and breaking it down for parents in a way that they realize, man, this is actually not as difficult as I'm thinking it is, and this is actually more effective. So I do agree that patience and compassion play a role here. Um, Anybody else? Oh, let me check the chat. Strategies for explaining a punishment trap to parents. Do you mean like the cycle of behavior that I was talking about when it comes to punishment trap?
Hey, Eunice.
Hey.
I just wanted to speak on when you mentioned about behavior suppression and how parents spank in the home and they don't spank anywhere else. That's usually like my go-to when I'm talking with families
Yeah.
that are heavy into punishment. And I kind of let them know, like, while that may work for you, that's not going to work for me because I can't. And then relay it back, like, would you want your kid's teacher spanking them at school? Do you want the therapist spanking them? So I try to relay it back, like, we want to find strategies that we can do across the board that is effective everywhere this child goes. So it's not just effective for you. And then also bring up points like how, kids, they'll go to dad, or they'll listen to dad before they listen to mom because dad is a disciplinarian. It's like, well, he never listens to me. Like, well, we created that relationship now. So where dad is doing something different between you. So he knows that you're not going to spank or whoop or punish or whatever the case, but dad is. And now we're really dealing more with fear. So just kind of relaying that is usually helpful when I say, I can't do those things and your teacher can't do those things either. So what's another strategy that we can try that can be done across the board?
Yeah, no, Lanisha, I definitely agree. And that's how I phrase it as well. I'm like, that's great for you, and I'm glad that's working. But unfortunately, I can't spank your child. So what can we do instead? And I think just going back to like the foundations of ABA. So like the SD, they know that reinforcement is available or this response is available. So that S delta means that this is not available. So when they're going to school and they know that, oh, only mom can spank me, like the behavior may increase at school. And then we have that, I just lost train of thought. when behavior increases in one area and decreases in another. Man, there's a word. But anyways, if you guys know the word, drop it in the chat. But yes, behavior.
Yes.
Oh my goodness. Yes. Yeah. So we have that. So I think explaining that to parents as well, and they're like, oh yeah, that actually, makes a lot of sense for sure. Oh, Lindsay. Okay. Then what's short term and long term? Sorry. No, my scroller doesn't want to work. Yeah. Well, short term, long term. Oh, okay, Lindsay. So it really just depends on the parent and also kind of what we are trying to accomplish. So kind of going back to the question about the correlation between spankings and like aggression. So in that conversation, I would probably say something like, since he's already having these aggressive behaviors in school, we really want to mitigate his exposure to things like this. So what can we do instead to prevent this behavior? But if there's no correlation there, it really just depends on kind of overall like the environmental variables that are contributing. But I do let parents know like the kiddos that we work with, they are hypersensitive to things like, punishment, aggression, violent situations. So since we already have the increased likelihood of them repeating those behaviors and not understanding social cues, we really want to make sure that we're minimizing punishment so that they're not doing it in other areas of their life. And then this could lead to XYZ. So really emphasizing that it's a lot different for the population, and unfortunately they can't be exposed to things like a typical developing kid. So I had a client who, this is not really punishment related, but he was engaging in like cursing and aggression at the school. So when I went for the intake, I realized that he was playing GTA, if you guys know what GTA is, but he's like 5 playing GTA. So I was like, okay, like, maybe, I mean, I don't think any 5-year-old should be playing GTA, but anyways, I was like, since he's already having these heightened behaviors at school, like we really want to make sure that what we're doing in these other environments are in alignment with what we want. So I would recommend, instead of GTA, how about he plays Mario Kart or whatever the case is. So that's kind of like how I would go about that. I don't know if that really answers the question, but yeah. Suspect spanking is occurring and grandparents are not admitting it in the clinic. Yeah, that's tough. I've had situations where I just kind of asked parents, and like if they've told me no, like if it's happening again, I talk to them and I say, hey, like I know that we talked about this before, and I know that you said that, you're not spanking or anything. I just want to let you know this is, a safe environment, and it's okay. I have parents who spank their children for whatever reasons, but we really need to know so that we can make sure that we're on the same page and I know how to address these behaviors because, he is saying this at the center. At that point, if the parent is still not admitting it, I can't force them to tell me or whatever the case is. So you kind of just have to plan around it. Now, if the kiddo starts engaging in behaviors that show that they're being abused or neglected, that's another conversation with parents. Like I'm very big on kind of letting parents know like, hey, if we suspect this, I'm a mandated reporter. So I would rather you tell me this so that we can figure this out before we have to kind of go to that next step. And I found that parents are typically more open when we have to get to that point because they just don't want it to get to that point. But yeah, unfortunately, if the parents decide not to disclose stuff to us, it's like, okay, I can't really help you, but I hope that one day you trust me enough. Yes, Marianne.
I just wanted to add to your point there is that I think there is like a strong need and level of rapport building with our families. So that those conversations can be really hard, especially in the autism community, because I feel like there's been several families that I've met that because their child engages in certain behaviors in the public setting, that's already an innate fear of theirs that they're going to get child services called. I've been in situations where a child refused to change out of one shirt for X amount of time and the school called on the family. And I had to step in and explain, like, we're working on it. It's a sensory issue. They're making those efforts. So I think that like to add to your point, like just making sure that you hone in on that rapport and that trust building so that way they feel comfortable enough to talk about it. And it's really important to do that from the get-go. And it's unique for every family, just like it's unique to build rapport with each one of our clients. So just be patient with them because it's a hard life they're living sometimes.
Yeah, no, I definitely agree. And I think I see over time, like as I'm meeting with parents, like over time they start to reveal more things to me because they realize like, oh, like I know Eunice, I can trust her. So now I feel more comfortable telling, you know, XYZ. So especially when it comes to punishment, like it's gonna do us a lot of it's going to be very beneficial for us if we know that the child is being spanked at home and for what reason, because now we can, you know, talk to parents and have that conversation and, you know, adjust our program as appropriate to address it. So if they're not comfortable telling us, we're missing a very big piece of information regarding the contingencies at home. And now that we can't do our job as effective as we need to. Krista, yeah, I'm pretty sure that there's some research on that with the correlation between being spanked at home and aggression with kids, whether they be on the spectrum or not. Yeah, that is really sad, but it definitely does make sense. So now I have to see if there's research on that and what that looks like.
Yes, one thing I've also seen sometimes is like parents will be like, well, I spanked them and they don't understand. But it's like, let's say I did something at school, but then like 8 hours later, you're giving me a
Yep.
letter for something that happened. And it's like, if you're going to deliver a punishment, the punishment should be like right then and there. But then also, what I've seen is like some parents don't understand
Mhm.
that I might not comprehend why you're whooping me, but also this is how I get the most attention out of you. It might not be the best attention, but it's like figuring out that part as well. Like I've seen kids lash out and then it's kind of like, well, why are you whooping me? Because it's basically like I robbed the bank this morning and now you want to arrest me like later on. It doesn't really tie. I mean, for us it would, but like for like other people, it's like I don't get it. Like it happened so long ago. Why am I getting punished now?
Yeah, I definitely agree. And I actually saw like an analogy. It's like when when you come home and like your puppy's like happy to see you and they're jumping up on you, and then you see that they pooped on the floor, so you spanked them. So now they think that you're spanking them because they jumped on you, and like it just doesn't align. So I think that delay in punishment definitely does play a huge role. Like for a typical development kid, yeah, cool, that may be effective for us, but for our population, it's just not the most effective strategy. So I definitely agree. All right. One time for one more question if anyone has any last question. Yeah. Yeah, exactly, Dustin. Okay. Nobody else. Appreciate all the participation. This is great.
Oh, you're having a great presentation, by the way. Good
Oh,
job.
thank you, Dustin.